So here we are at the Alaska Nurse Practitioner Conference in Anchorage, and why don't you give us your name and why it was that I said we got to record this.
So my name is Diane Maythorn, and I work in Wasilla, Alaska, but I'm from Willow, and I'm a nurse practitioner. And Dave's already kind of heard my story. I had kind of a rough summer. My husband and I lost our house in a house fire at the beginning of the summer, and halfway through the summer, I became a patient myself, and because of a traumatic brain injury, I fell off of my horse and hurt myself quite badly.
And so how did e-patient issues work into this?
So I just think from it, my personal experience is that it's been really interesting being a patient, but I still think that we need to have better communication, and I'm so excited about the way that you're engaged in being a patient, because I don't see that very much. I just don't see that level of engagement. And when I do, people are looking at information that's not very good information. So I like the idea of a kind of a stewardship of giving people sources that they can look at, resources that they can use.
Talk to me here. Yeah, developing their abilities,
yeah,
right?
Absolutely.
So how did being a patient, a provider who is a patient, did that alter your perspective?
It has absolutely altered my perspective.
And how so?
So I've told people that I've been through some pretty rough things, but recovering from this brain injury has been one of the worst things I've done, one of the hardest things I've done. It's made me a lot more empathic for patients who have silent diseases or hidden diseases.
Okay.
Because you feel like you are not right, but people don't see it because you look normal on the outside.
Have you heard of spoonies?
Yes.
You have? Okay, great.
Yeah,
so,
I'm being very careful with my spoons. People look up spoon theory.
Yeah, absolutely. Christine Miserandino. Yeah. Has your attitude toward patients regarding them being engaged and the patient-clinician partnership, has that altered? And can you give me an example, if so?
I don't know that it's necessarily altered since the brain injury, but it was altered when I joined the practice I'm with currently.
Okay.
So one of the physicians that I work with, if she has a patient about whom she's concerned, or if she's done a procedure during the day, she'll often give that patient contact information so they can contact her after hours specifically if that patient has questions. And so I've started doing some of that. My patients see my blog if they want to access it.
What's the name of your blog?
It's Nurse Diane in Alaska at WordPress.com.
Okay.
I've also started giving my phone number and encouraging people to text me if they have something concerning come up. And for the most part, it has not backfired. I mean, I've had a couple of people that I've had to tell, cool off, you're taking up a lot of time, but most people are very respectful and grateful for the chance to contact me directly if they have questions.
And do you have any anecdote, just as we wrap up, any anecdote of a case where that was useful or maybe even important?
Oh, sure. So one of the procedures that I routinely give patients my cell phone number after I've done it is a colposcopy, which is testing abnormal cells on the cervix. So it's a female procedure. And I have had patients call me after the procedure is over about pain management or bleeding, just things that would be scary to them where they need some support.
Sure.
And if they're talking to me, I'm the person who did the procedure, which is way better than having them call our after hours line and talk to any physician who's on call.
Yes.
So
great. Good. Well, I'm thrilled to hear that hasn't ruined your life. So.
No. And people have been generally respectful.
Great. Well, this is Dave and Diane in Anchorage, and that's all for now.
Thanks, Dave.